Hi, Adele. My name's Kimmy, and I'll be the psychiatric mental health nurse practitioner helping you today. Thank you for being here. Before we get started, I just want to let you know that this is a safe, confidential space. I will only ever breach confidentiality if I feel like there are safety concerns. My goal is to really understand what you've been going through so we can figure out how to best support you. Does that sound okay?
Yeah, that sounds okay.
Great. And just to check in, what name do you prefer to go by?
Adele is fine.
Okay. What brought you in today?
I feel like I can't leave my house anymore. I get really, really anxious just thinking about going out.
Okay, that sounds super overwhelming, especially if it's gotten to the point where it's affecting your ability to leave home. Can you tell me more about it? When did it start?
I would say it started about 6 months ago, but it has definitely gotten worse over the last couple of months.
Okay, was there anything going on around that time that you think might have triggered or worsened it?
Not really. It just kind of started happening more and more and more.
That can be really frustrating when it feels like it came out of nowhere. When you do try to go out, what usually happens?
My heart races. I feel like I can't breathe. I actually get scared that I'll pass out or even lose control.
Those physical symptoms can feel really scary. Where do you notice this happens the most?
It happens in stores, crowded places. It even happens when I'm driving.
Okay, so it sounds like situations where there are a lot of people or where you might feel stuck tend to bring it on more. What do you usually do when you feel that way?
I just leave, or I just don't go anymore, or don't go out.
How often is this happening?
Almost every time I try to go somewhere.
On a scale of 0 to 10, with 10 being the most, how intense would you say is the anxiety?
Definitely like an 8 or even 9.
That's pretty high. No wonder it's been so hard to push through it. Has anything helped at all?
Staying at home or having someone with me at all times. It has become so bad that I had to stop working even. I barely see my friends anymore.
Okay, and when these episodes happen, do you notice things like sweating, shaking, chest tightness, or feeling like something bad is going to happen?
Yes, all of that.
Do you ever feel like you're detached from yourself or your surroundings?
Yeah, sometimes.
Have you ever had repetitive thoughts that feel intrusive or hard to control, or feel like you must do certain behaviors over and over to reduce the anxiety?
No.
Okay, and then any nightmares, flashbacks, or feeling on edge, like something bad might happen even when you're safe?
No, nothing like that.
Okay, thank you for sharing that. It's really helpful for me to understand what you're experiencing. To make sure I understand you fully, would it be okay if I asked a few questions about your background?
Sure, no problem.
Have you ever been diagnosed with a mental health condition before?
I was actually told I had anxiety a few years ago.
Okay, and who told you you had anxiety?
My primary doctor diagnosed me with it when I was in college 3 years ago. And he started me on Zoloft and recommended that I see a therapist, but I never actually went to see a therapist, and I only took the medicine for a little while.
Okay, that makes sense. Sometimes it's hard to follow through with therapy, especially if you're not feeling better right away. Did the Zoloft help?
Honestly, I don't think so, but I didn't really stay on it for longer than a few weeks.
Okay, that's helpful to know. So many of these medications can take a long time, a few several weeks to really start working. Do you remember what dose you were taking? And were you taking it consistently every day during that time?
No, I don't remember the exact dose really. I think I took it most days, but not always perfectly.
Got it. That's pretty common, especially early on. Do you remember if your doctor had talked with you about how long to stay on it before deciding that it wasn't working?
No, not really. He didn't.
Okay, so we can definitely talk more about what to expect with medications moving forward. Do you remember what your anxiety looked like back then? Was it similar to what you're experiencing now or different?
No, it was more general worrying back then, but not like this.
Okay, so it sounds like your anxiety has changed a little bit and maybe become more intense and situation specific over time. Do you remember if anything helped your anxiety at that time?
No, not really.
Okay, and do you remember why you stopped the medication? Was it side effects or something else?
I just didn't like being on medication, and I felt like it didn't do anything.
Okay, that's understandable. Have you ever taken any other psychiatric medications before?
No, just a Zoloft.
Okay, and have you ever been hospitalized for mental health reasons?
No.
Do you have any medical conditions? Things like diabetes, high blood pressure? Has your doctor ever checked things like your thyroid or ruled out any medical causes for the anxiety symptoms?
I don't have any medical conditions that I know of. I actually saw my doctor about 6 months ago and we did a lot of labs. And all he said is that my labs look good.
Okay. Do we take any daily medications or any over-the-counter medications?
No, nothing daily or over the counter.
Okay. Any substance use, nicotine, vapes, cigarettes, tobacco, alcohol use?
I drink wine occasionally. I would say socially, like twice a month and just 1 to 2 glasses in a night. I've never smoked cigarettes or vapes or anything like that before.
Okay. Any other illicit drug use?
Oh no.
What about caffeine? Do we drink coffee, energy drinks, or pre-workout?
I drink coffee most mornings.
Okay, yeah, but about how much per day?
I would say 1 to 2 cups.
Okay. And have you had any recent changes in appetite, weight, headaches, or any other physical concerns?
No.
I also ask all of my patients this. Are you currently pregnant or trying to become pregnant or using any form of birth control?
No, not at this time. I am using contraceptions so I don't get pregnant.
Okay. And any family history of anxiety, depression, or other mental health concerns?
In my opinion, my mom definitely has anxiety and it's not managed well at all. Otherwise, my parents are pretty old school and don't really believe in mental health, so I'm not sure if they would ever even get an actual diagnosis. My sister might actually have anxiety as well, but I'm not 100% sure.
Okay. And growing up, were there any developmental concerns or major stressors?
No, I had a pretty normal childhood, and my mom always told me that I reached all my milestones and whatever.
I also want to ask, have you ever experienced any trauma in your life, such as emotional, physical, or sexual abuse, or any events that felt really scary or overwhelming?
No, nothing like that that I can think of.
Okay, thank you for telling me all that. You mentioned earlier that you recently stopped working. What was your occupation prior to this?
I worked at Nordstrom in town center, and honestly, I really loved it. My clients were usually pretty nice, and my coworkers were very uplifting. So this has been a very hard adjustment, and also has me stressed financially, even though my husband makes a decent living.
That sounds like a really positive work environment. You can tell it meant a lot to you. Can you tell me a little about your educational background? What's the highest level of school that you've completed?
I completed some college, but I didn't finish my degree.
Okay, and what were you studying?
Business, I was studying business, but I ended up going straight into retail.
Okay. Do you have any goals of going back to school or changing careers in the future, or is that something that's been hard to think about right now?
Honestly, it's been very hard to think about anything like that right now.
Mhm. That makes sense, given everything you've been dealing with. Can you walk me through what your day-to-day has looked like these past few months without working?
I essentially just do laundry and clean the house. I've been reading a lot and watching TV. I try to do yoga with YouTube videos to keep active. Before this, I was actually going to yoga classes with my coworkers, and I was just a lot more social.
Okay, and who do you currently live with?
My husband and our 2 cats.
Okay, do you feel supported?
Yeah, but I feel bad relying on him. He never makes me feel bad about it, but at the same time, he is very much an extrovert and loves going out and doing things. So I think this has been hard for him too.
Okay. Outside of your husband, do you have other support? Family, friends, or anyone you feel comfortable talking to?
Not really anymore since I stopped going out.
And how has this been affecting your relationships or social life overall?
I've definitely come more isolated and I feel more alone.
What are some things you enjoy to do, or what used to bring you joy before this started?
Going to yoga classes and hanging out with my friends.
Do you have any spiritual or cultural beliefs that are important to you that help you cope?
No, not really.
Okay. Any legal issues and concerns at this time?
No.
Okay, I'm going to ask a few questions about your mental health overall. How would you describe your mood lately?
Pretty low. I feel pretty stuck.
Okay, any loss of interest in things you used to enjoy?
I would say yes.
And how are we sleeping? Any issues falling or staying asleep?
I don't sleep well at all. I worry a lot at night.
Okay. Speaking of sleep, have you ever had a period of time where you needed much less sleep but still felt energized? Maybe more you were more talkative than usual, had racing thoughts, or engaged in risky or impulsive behaviors?
No, not ever.
Okay. Have you had any thoughts of wanting to harm yourself or feeling like life isn't worth living?
No,
Okay. Do you have access to any weapons at home, like firearms?
no,
And any hallucinations or hearing voices that are not your own?
nope.
Okay. I notice you seem a bit anxious. How are you feeling right now talking about all of this?
I definitely feel nervous, quite nervous.
Okay, that's understandable. It took a lot of courage for you to come here today and tell me all of this. I just have a few more quick questions. Are you currently driving at all, or has the anxiety impacted that as well?
I avoid it as much as I can.
And have you started avoiding certain places or situations completely because of fear of having a panic attack?
Yes, definitely.
Okay, thank you for walking me through all that. I really appreciate how open you've been. Based on everything you've shared, it sounds like you're experiencing some pretty significant anxiety related to leaving your home and being in public spaces, along with some panic symptoms. This is consistent with something we call agoraphobia, and often with panic attacks. Does that sound like something you've been experiencing?
Yeah, actually, that sounds just about right.
We also consider things like panic disorder or generalized anxiety disorder, but your avoidance of situations is a key part of what you're describing, and that sounds more like agoraphobia. The good news is it's very treatable, and you've already taken an important first step by coming here today. There are a few options we can consider together. The first being therapy, especially something called cognitive behavioral therapy or CBT, which helps you gradually face these fears. We can also do medication, a class called SSRIs to help reduce the anxiety, and we can also learn coping skills for panic symptoms. What feels most comfortable for you to start with?
Maybe therapy first. I want to start that and see if I can manage these symptoms without medication, if that's okay.
Yeah, that sounds like a great place to start. We can focus on therapy and coping skills now and always revisit medication later if you feel you need additional support. As part of that, it can also always help to understand what's happening in your body during these moments. So what you're experiencing is your body's alarm system becomes overreactive and it feels very intense, but it isn't dangerous. With the right support and gradual steps, you can absolutely rebuild your confidence and begin leaving your home again. So before we wrap up, if your symptoms do worsen or if you ever feel unsafe, please contact our office, call the crisis line at 988, or go to the nearest emergency department. I'll put in a referral for therapy for you, and they'll reach out to you within the next few days. And let's plan to follow up soon. How does 2 weeks sound?
That sounds great. Thank you.
Okay. And to summarize, today we talked about your anxiety with leaving home, panic symptoms, and how it's been affecting your life. We're going to start with some therapy and begin building coping skills together. What questions do you have for me?
That sounds good. I feel a little better already just after talking with you. I thank you. I don't have any specific questions right now, but if I do, how do I get in touch with you?
You can reach me on the online patient portal and send me a message there or call the office, and either the medical assistant or I can answer the question for you. Thank you for sharing all of this with me today. Again, I really appreciate your openness and courage. You did a great job, and we'll take this one step at a time together.
Thank you.